Go ahead and introduce yourself. My name is Becky. I'm going to be your nurse today. Could I take a look at your armband? And can you tell me your name and date of birth? Excellent. It matches perfectly to what he said. And can you tell me if you have any allergies? No? Your physician has ordered to remove the nasogastric tube today. It's a fairly quick procedure, much quicker than going in. You may feel a little bit of discomfort, you may gag, but I'll have an emesis basin and we're going to work together and get this done as quickly as possible, okay? I'm going to raise the bed and lower the bed rail. And then I'm going to don my PPE and my gloves. Before you remove an NG tube, you want to assess bowel sounds and ensure that your patient has good bowel sounds in all 4 quadrants. Lower their blankets and raise their gown. Excellent. Positive bowel sounds in all 4 quadrants. I'm not going to put on my face mask so that you can hear me clearly, but you want to make sure that you do protect yourself. And unfasten the pin. And I need to check placement because I want to flush this tube before I pull it out to make sure that, number one, there's not gastric secretions in the tube that he might inhale as we're taking that tube out. And number two, I want to make sure that it's not adhering to the gastric lining because I could tear that if I just pull it out. Now, if I go to check placement and I can't verify that it is in the stomach, I'm going to take the tube out anyway. I just won't flush it first. And ideally, I should flush it. So I'm going to go ahead and check placement. Here, we do it by measuring. Other places, it may be air bolus, or it could be gastric pH. I see it's 95 centimeters. So it hasn't moved from the time it was inserted. And now I want to go ahead and flush the line. So I'm going to kink the tubing and take off the cap. Take the plunger out of the syringe, holding both pieces, the tubing and the syringe. Instill 30 milliliters of water and flush that tube. Again, holding both pieces. Let that go in by gravity. Kink the tubing and take this off and replace the cap. Move this up and give him his emesis basin. I've got the patient in high Fowler's for this. Again, if he gags, I don't want him to aspirate on vomit. I'm going to instruct my patient that when the time comes, I'm going to ask you to take a deep breath and hold it. That's going to close the airway so that as I pull it up, if there is any fluid in that line at all, it's not going to go in his lungs. I'm going to hold the tube securely and take the tape off the nose. I can leave it on the tube though because I'm going to be throwing the tube away. All right, I'm going to have one hand near his nares and this right hand is going to pull the tube out. That way I've got a hand right here to grab the tip when it comes out so it doesn't hit him either in the eye or in the mouth. Take a deep breath and hold it for me. I've got the tip. Carefully I wrap that tip up. You did a great job, it's all done. This is going to go in the trash. Now I'm going to remove my gloves and then I'm going to assess my patient. In the trash. I'm going to give him some tissues to blow his nose. Look at the nares. Excellent. Can you say ah for me? Good. I'm checking to see if there's any kind of irritation or early signs of skin breakdown in either the nares or the back of the throat. And I don't see any, so that's ideal. If your patient is allowed, you can offer them something to drink at this time. You can certainly offer them mouth care. Maybe they want to brush their teeth and move your basin. I'm going to raise the side rail and lower the bed. Next, I'll remove my PPE. Then I'll wash my hands and document the procedure.